Hi everyone, Imogen and I are back for a little chat all about hip mobility and strengthening today. So we've done quite a few sessions all about mobility and functional mobility and different types of movements, and we've started looking at particular areas of the body. So we're going to be functioning and thinking about hips today. So welcome Imogen. So hip mobility and strengthening. Now, we'll start off perhaps talking about the issues which people tend to come to us with on a regular basis. Sometimes it is it feels muscular, sometimes it feels like it's in the joints, sometimes it is because people know they are doing certain movements or perhaps not doing certain movements, or they might be athletes or people who are just general exercisers and feeling maybe tightness through hips or lack of range of motion through the hip area. So I'll hand over to you first today, Imogen, just to let us know what kind of things you come across and what would be your main recommendations for your clients.
Yeah. So when we're looking at sort of like you say, like the hip mobility sort of related issues, a lot of the time I get is either people, like you say, it's the sort of feeling tight, stiff, they're noticing particularly into sort of like your external rotation or that lateral rotation. So when you're sitting, so particularly sort of if you were to sit cross-legged or any of that type of stretching sort of movements, it's those types of positions I find that people tend to sort of tell me that they notice that then the sort of the stiffness at the hip. And it'll either be that it just feels sort of stiff and that they can't get into this range, or sometimes I get quite often is the sort of like more pinching sort of sensation, that there's sort of like a catching sensation up around that groin hip area. The other type of complaint that I'll get quite often is actually more that it's more on sort of the lateral side of the hip, so around that greater trochanter, I can't get my words out, rather say the sticky outy bony bit on your hip on that femur. That can also be quite, some people either say it's sore, some people will say it's sore to just lay on, or that they'll feel the sensation there if they're doing certain movements. Sometimes it's actually tender to touch, and things like this I'll notice. Very occasionally you'll get some that will say actually they can feel it in the actual glute, and then you'll get the sort of sensations of like more of the typical, what people think would be like the sciatica type sensations, where they'll feel the referral down the leg. Sometimes it might be felt even at the knee, rather than actually at the hip itself, particularly for sort of like that lateral knee. So when it's sort of thinking about like your runners and stuff like this, you'll sometimes find it in that sort of outer knee area. So they're the sort of the common areas and sort of the sensations. Generally, it tends to be, like I say, a stiffness, or occasionally it's that sort of sharper, catchy pain. Sometimes it can be an ache, or and very occasionally I find it's more of a neural sensation if it's coming down the back of the leg, but generally it's, like you say, the stiffness. So when it comes to turning to like my advice of how to deal with these sorts of things, it kind of obviously depends on the individual and what they're doing. For those that aren't particularly active and so are a little bit more sort of like either desk bound or in the driving and things like this, then generally I find actual just adding any types of movements is helpful, because we're quite good at doing the whole like up down sort of position, so going sit to stand and that type of thing, but we don't add any rotational movement. There's no sort of that lateral side to side type movement occurring through the hip, and the hip's quite mobile, so a bit like the shoulder we were talking about before, it's quite a mobile joint. There's quite a lot of range of movement there, not as much as the shoulder because it's more weight bearing, but it's still a mobile joint, so still likes movement. So I find adding movement can be useful for those that don't do much moving. And then the other side with those that do that, plus also the ones that may be a bit more active, maybe a little bit better with the mobility, because hip mobility is something that people talk about quite a bit. And generally is quite easy to fit into a routine, I find. Most people are quite good at adding bits and pieces in for hip, the sort of hip group, is the strengthening side of stuff. Like quite often I would find if people are stretching because they feel tight in hip flexors or tight in hamstrings, they stretch, and then it doesn't make it any better, and it's actually getting worse. And generally I find that if you add then the loading element into it, so whether it is more sort of mobilizing, but you're sort of doing it through more like the eccentric ranges, so you're loading it a little bit more, or actually generally just doing strength training, that you can sometimes have a more positive effect, just because I find that it needs that bit or more or a sort of resistance type training in through the hip and stuff. It can respond quite well. Same with hip hamstrings, though. They're another group I find actually sometimes if they're tight or that sensation of stiffness and things, that if you load them, they're a little bit better at kind of that sense of relief and relaxation than if you stretch it.
Yeah, totally agree. So again, this is one of the issues which I come across with my clients, and they will, we've talked a lot about kind of functional movements, mobility, making sure that you are using the joint in the variety of different ways in which we can use it, which is obviously really important, because you can still get that stiffness through lack of usage in particular movements, and your body just adapts, doesn't it? You just kind of adapt to not moving in certain ways. So I know in the past we've talked about making sure that if you do have a sedentary job, you're sitting at your desk for long periods of time, so you've got essentially your legs in this, you're sat here and then your legs are down, and you've got your hips always in that same position for long periods of time, obviously getting up and walking around, etc. And then maybe doing squat like movements, lunge type movements, where you're moving not just up and down, but like you say, laterally side to side. And people think that doing those and then kind of stretching, again, particularly stretching things like hip flexors and glutes, hamstrings, is going to be really beneficial. Of course it is. But like you said, the opposite kind of side of the coin, which most people forget that actually would be more beneficial, is actually strengthening some of those weaker muscles as well that, aren't perhaps used as much. Now, obviously, things like your quads, your hamstrings, calves, your glute max, are used a little bit more. But what we don't use enough is, and we've talked about these before when in relation to shoulders, is you stabilize the muscles. So muscles, things like abductors, adductors, glute medius at the top of actually your glutes is a good stabilizer for certain movements between the hip and the knee. So stabilizing the leg movements between that area. And then we've got loads of other little stabilizer muscles kind of between the hip and the knee, again, that just get overlooked a lot of the time and don't get strengthened. People don't know either how to strengthen them and what kind of exercises to do, or they're perhaps not engaging with them enough. Again, when we've got kind of weaker muscles in those areas, what we tend to do is, rather than engaging with them if we don't know what they feel like or how we should be using them for certain movements, we end up kind of relying more on those prime movers, and again on things like other hip flexors and hamstrings, which is where you get that ache because you're kind of over relying on them. It's a bit like a tendinopathy. They're being overused too much. They should be able to be used, but you need to make sure that you're strengthening other areas so that you've got an overall kind of selection of muscles that you're using for certain movements. And by strengthening those, again, you would take that strain away from those other muscles, less soreness in other areas. Again, people take that when they feel that soreness as something where they need to do more stretching, etc. And actually, for some people, stretching even more can make it worse. When you're overdoing it on kind of ligament and tendons being kind of stretched out too much, you want to make sure that actually it's not necessarily, that's not the issue. It could be a strengthening issue. So that's where a lot of the kind of programs that I do for people, I always make sure that I include a lot of strengthening of those other muscles, so that it takes that that element away from people, particularly, as I say, if they are sitting down a lot of the time for their job and they can't help but be in that set position with their hips for long periods of time. So yeah, 100% agree that strengthening is a big missing piece of the puzzle, shall we say, for lots of people when they don't realize it. A lot of the time they think, well, they shouldn't work those muscles that are perhaps sore. They've got hamstring issues. You still want to obviously strengthen those as well. But yeah, you don't want to kind of overdo it in one area and not enough in another, or not strengthen them at all because you think, oh, there's an issue there, and so therefore you avoid it and it's not going to get any better. So yeah, I mean, I don't know if that's the kind of thing that you were thinking of.
Yeah, for sure. I mean, I think for the hip, like you say, particularly, that's the balance and the mix of the mobilizing and the strengthening is really important, just because, like, I mean, even if you go sort of more to the basic element of the fact that when you look at what the joint's doing, like that joint, like I said, it's a mobile joint. It's like the shoulder, it's the ball and socket, so it can rotate and move around.
Yeah.
But we stand, we walk about, we move around and stuff, so it's weight bearing, so it needs strength in it in order to be able to help move us under the load in the gravity and type of things like that. So it needs both because of its function, what it's doing in the basic level. It is doing both. It's both.
Yeah, and what I tend to find actually in terms of going back to mobility is when I kind of do assess people's mobility in the hip area, I tend to find no matter what their kind of hip anatomy, because everyone is slightly different in terms of how long their femurs are, how large or how deep the ball and socket joint is, and what kind of angle those kind of bones are coming out of your hips, you know, because everyone is slightly different in that respect. But I tend to find that a lot of people, particularly again when you're kind of seated for a job, are better, naturally feel more comfortable in an externally rotated position. So that's with kind of knees tracking outwards as such, and do tend to feel more blocked. You know, you mentioned that kind of blocking sensation, pinching often when you try to put your knee into an external rotation. So you're bringing your knee inwards across your body or inwards and upwards at the same time. Do tend to find that people really struggle with that position. So sometimes even just kind of doing mobility work for internal rotation helps for, you know, just increasing your range of motion through that hip joint, but also just for doing some of those other functional movements that we talked about and strength training as well. The more mobile you are, both kind of internally and externally, the better. And so just doing things like some hip banded mobilization, so where you've got kind of a long looped band, resistance band, you pop it round, you put your leg through, pop it the leg through up to the, bring it up to the hip joint, and then attach your band to something, and then you're kind of bringing in, sometimes people will do it kind of kneeling down, and you can bring one knee in internally across your body and just gently kind of open up and close up that hip kind of movement and just kind of pull it in that direction. Just again, it could be your body's just not used to doing that movement, so you need to just gently kind of increase the range through there. Some people naturally do find it harder with things like the internal rotation movements, and you can't obviously change your anatomy, but definitely I've seen improvements with people just doing some basic level resistance band work, particularly joint mobilizations with those, that have just made a relatively decent amount of difference to how they move and how they're not feeling. It doesn't, you know, you can increase the range of movement in general through that hip. So when, for example, the people that I'm working with, let's say they're doing squats and lunges and things like that, they're not going to get that pinching sensation. They're not going to feel kind of blocked in terms of where they can get to. You know, if it's not ankle mobility sometimes stopping you do these things, it is the hip mobility, particularly through internal rotation. And I actually find also sometimes with runners, but particularly with cyclists as well, this can be a bit of an issue if they continue to externally rotate too much when they're rotating you know, their legs as they're cycling, because they're feeling a bit more blocked, a bit more pinchy. It doesn't feel comfortable with the knee kind of tracking straight in front of them over the toes, because they're trying to obviously, you know, pull that knee in a little bit more, but feeling uncomfortable. So again, things like internal rotation banded joint mobilizations I find really help for people like that, because what they, you know, tend to find, obviously being not in an optimal position, if that knee is tracking out a little bit when they're cycling, that then causes other issues later down the line when they're doing that for long periods of time, really.
Yeah, for sure. And I mean, I think going in with what you were saying about that everyone varies and stuff, it's thinking more like comparing it to both sides, so you can check like that. With this one, it's always quite useful to be able to compare between the two sides, isn't it, of being like,
yes,
don't worry about what the person next to you's mobility is like, it's just compare it to your own body and look at your own left and right, because and then in the case of then feeling of, like you say, like it may not be as much as somebody else, but as long as it's the smooth movement and it's feeling comfortable, it's more about the quality of what you're moving rather than the quantity of how much range you're getting in either direction.
That's right. Yeah, and as I say, it's really, that's a good point to make. It's a bit like anything actually, in terms of, certainly in terms of exercises and range of movement and things. Everybody is so different, and you're not going to have the same range as the person standing next to you, and it's just making sure that you are tracking your own body, what difference you're making, and like you said, looking at imbalances, looking at those side to side differences. I always tend to find with most clients who walk through my door, particularly with injuries or little niggles and things like that, there is an imbalance somewhere. It's not necessarily always actually on your weaker side, which is what most people think it would be. Sometimes it can be on your stronger side, because again, if you've had a previous injury or you have felt weaker, obviously on a weak side, so for me it would be my left hand side, if I've got that weakness, sometimes what I'm doing is I'm doing things like hip shifting, knee tracking out too much, toe tracking out kind of differently to the other side, just to stabilize myself a bit more, because I'm putting more into one side, what I felt was my stronger side, than the other, but end up kind of being injured there, or feeling like you're kind of putting too much through one hip, and then again that causing additional issues, because you've got an imbalance on the two sides. So again, comes back to strengthening, and not just mobilizing and thinking about range of motion. You will increase that range if you strengthen that kind of the weaker side, the imbalances, so that again you're not putting too much pressure on the one side and being too over reliant on your stronger side, which ends up becoming your weaker side, because you end up getting an injury. So yeah, it's getting that right balance, isn't it, between both mobility and strength, really.
Yeah, and I think, and also kind of latching onto that sort of imbalances to speak and stuff, it's like, so the discrepancy in terms of the ranges and things you might notice between left and right as well, and that might not necessarily be a bad thing in itself, given depending on what you're doing. Like for example, like if you're a sweep rower, like you are going to naturally have a slight imbalance of what you're doing, and actually you kind of need it for what you're doing. But it's a case of when you're looking and testing in those sorts of areas, where if you are kind of like, okay, well, it is different, but it feels like it's feeling smooth, it's feeling pretty even though one is moving more. It's like, well, that's not, as long as it's not causing hindrance, you're not, and you are, like you say, moving in an efficient manner, so you're not overusing certain pathways over certain groups and then leading yourself to an injury, then that's okay. Like that's fine. That's like, it's normal to be like that. We don't need to be striving for the symmetry on both sides. It's just that the symmetry is in the fact of, does it move smoothly? Can you move without any sort of discomfort? And are you moving efficiently, so you're not overworking certain groups?
Yeah, like you say, you cannot change the fact you are probably going to have a slightly weaker side. Obviously, if you work night and day trying to kind of correct that imbalance, you could probably do it, but I know that I'm always going to be slightly weaker on my left hand side, even though I will try my best to kind of strength train in the same way both sides. It is the way that's going to be. But again, with things like hips in particular, you can see a real kind of hip imbalance, particularly when people just do a good body weight squat for me, and I see a massive hip shift over to one side, clearly over relying on that side for whatever reason. It's then looking at, well, why is there such an imbalance, and is that causing you an injury? Could it cause you an injury over time? Because these things don't happen straight away. They actually kind of build up over long periods of time. You don't realize you're doing something like a hip shift, for example, and then that can impact on other things later down the line. So again, minor imbalances always going to be there, but when you see something significant, it's going back to the root cause. It's not necessarily something that's on that side. It's actually a correction that needs to be done in perhaps another area, which will then, when you strengthen that other area, you're going to be able to kind of balance things up a little bit more in terms of how much you're relying on those side-to-side differences.
Yeah.
Okay, right. So hopefully we've covered a few little extra bits and bobs today, particularly around hips, but also kind of strengthening as well as mobility being really important. And we'll try and perhaps cover another body area and joint in our next conversation. Thank you for joining us, and we'll see you again next time. Take care.